Good morning. My name is Dr. Kevin Ford, and I'm a member of Omega Psi Phi Fraternity Incorporated Gamma Pi chapter. And this morning, we're having our monthly health webinar. And this month's webinar is on Alzheimer's. And we're pleased to partnership with the Alzheimer's Association. And today we have Ms. Karen Fagan, who's from the Alzheimer's Association, and she'll introduce our speaker. So, Ms. Fagan.
Thank you, Dr. Ford. Thank you again for inviting us back to continue our discussion on Alzheimer's disease and dementia. The speaker today is Robert Dantzler. He is a native of Orangeburg, South Carolina. He is a proud alumnus of Claflin University, where he earned a Bachelor of Arts degree in American Studies, and South Carolina State University with a Master of Arts in Teaching and English Education. Dantzler is currently an adjunct professor at the University of the District of Columbia, where he teaches interdisciplinary studies and general education courses. He is also an independent author, having self-published 3 books, an editor, and a writing coach. Dantzler's work with in connection to Alzheimer's has come through his personal experience, having been a caregiver for his maternal grandmother and backup caregiver for his maternal grandfather, both who were diagnosed with the disease. Dantzler has also been trained as an Alzheimer's community educator with the National Capital Area chapter of the Alzheimer's Association. Additionally, he was part of a video recorded by AARP highlighting stories of millennial caregivers. One of Dantzler's missions is to share the stories of his experiences, to give hope to other caregivers, and to encourage them to seek the assistance they need and take advantage of all available resources. I am going to go ahead and share my screen now. Can everyone see that?
Yes, I can.
Okay. Robert, go ahead and begin.
So good morning again, and thank you. Just echoing what Ms. Fagan just said, thank you to the Alzheimer's Association, as well as the men of Omega Psi Phi Fraternity Incorporated for inviting us back for this discussion this morning. And this morning we will talk about understanding Alzheimer's and dementia. Okay. Okay, so we first want to look at our learning objectives of what we want to cover today and try to accomplish today is to compare Alzheimer's and dementia, recognize how Alzheimer's disease affects the brain, list the risk factors of Alzheimer's disease, identify the stages of the disease, recognize the current FDA-approved treatments, as well as describe how scientists are working to advance research, as well as give you a list of available resources through the Alzheimer's Association. Okay, so let's first take a look at the impact of Alzheimer's. We want to start with a little quiz here of testing your knowledge. So here we go. So it says approximately how many Americans are currently living with Alzheimer's? Over 3 million, more than 6 million, about 8 million, or about 11 million. I'm not sure if folks have access to a chat where they can plug in real quick, but okay, well, we're just moving forward. Okay, more than 6 million Americans living with Alzheimer's currently. That's the correct answer. All right, and next question is about how many Americans provide unpaid care for people living with Alzheimer's or other dementias? About 8 million, over 11 million, over 14 million, or more than 18 million. And the answer is over 11 million people currently provide unpaid care for persons with Alzheimer's or other dementias. All right, so let's look at some of the facts. All right. So we saw that we ran through some of those facts kind of quickly, and we're going to get a moment to highlight those in just a few. But now let's look at Alzheimer's and dementia, looking at, say, the difference or the relationship of how that goes. Okay. So again, we want to test your knowledge real quickly. So true or false, Alzheimer's is a normal part of the aging process. This is false. Alzheimer's is a brain disease that causes problems with memory, thinking, and behavior. And just to be clear, it is not a normal part of the aging process, because there are some who believe that when you get a certain age, it's bound to happen. That's not true. Okay. Another true or false, people younger than 65 can get Alzheimer's. And this is true. Although it is much less common, people younger than 65 can also develop Alzheimer's, and this is what is known as early onset Alzheimer's. Okay. So right now we want to hear from an expert who will talk about distinguishing Alzheimer's and dementia.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
And now we want to share a video on
Certainly,
why it's
having
important
the
to be diagnosed.
diagnosis of Lewy body was helpful in our planning because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
Okay, so now let's do a quick recap. So dementia is the general term, or like what the experts say, it's an umbrella term of different types of dementias, and with Alzheimer's being the most common type. And again, it is not a normal part of the aging process, but again, it is a progressive brain disease. And we'll talk a little bit more about that as well. And yeah, and so again, it's a collection of different symptoms that once they become severe, it slowly progresses over a period of time. So let's look at how Alzheimer's impacts the brain.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
Okay, so a quick recap. More than 100 years ago, Dr. Alzheimer described this as significant or specific changes in the brain, the formation of the plaques and tangles. Alzheimer's causes nerve cells to die, which leads to shrinkage in the brain. And something to keep in mind is that with brain cells, when brain cells they die off, they don't regenerate. And so that's why it's important to talk about the different types of preventative measures as well as look at the different types of treatment, because brain cells, once they're gone, they're gone. And the brain changes result in changes to the memory, thinking, as well as behavior. All right, so now let's look at some of the risk factors. Another test your knowledge. A couple questions. So what is the greatest known risk factor for Alzheimer's? Is it genetics, family history, or age? Although Alzheimer's is not a normal part of the aging process, it is the greatest risk factor for the disease. After age 65, the risk of Alzheimer's doubles every 5 years. 34% of people age 85 or older have Alzheimer's. All right, so let's hear from another expert.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
All right, so it's important that we do note, or that we are aware of, if not already, that Hispanics are about 1.5 times as likely as whites to develop Alzheimer's disease and other dementias. And African Americans are about twice as likely as whites to develop Alzheimer's. And almost 2/3 of Americans with Alzheimer's are women. So let's recap that really quickly. So again, age is the greatest known risk factor for Alzheimer's, and an individual's risk for developing the disease increases at age 65. And again, noting that it is not a normal part of the aging process, but it is a risk factor. Family history is also a known risk factor. Having a parent or sibling with the disease increases an individual's risk. And there are also risk genes and deterministic genes are the two types of genes associated with Alzheimer's. And Hispanics and African Americans and women are at an increased risk of Alzheimer's. So now let's take a look at the stages of Alzheimer's disease. So we want to look first where it says, what does living with Alzheimer's feel like?
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before in order for you to continue to read on. And so I can't read a novel, so I've even stopped trying.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life. You know, as an avid reader, as a reporter, as a writer. Um, I struggle with them now.
I'm like an overachiever. And when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
I think the thing that surprises me the most about my dementia is that it is progressive, and I'm finding that I'm forgetting more, and they do memory tests for me all the time at the doctor's, and so that becomes a little disconcerting at times, to see my cognitive impairment continue to decline. Um, but again, I really have hope. Um, I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
Okay, so something I would want to just point out quickly about this is, or highlighting, is when they talk about the different kind of forgetting. So we know that all of us, we forget things. Just like you say, we may put our keys down, we may forget where we put something. It's a little bit deeper than just like what we experience is like surface level type stuff. This is when folks have the inability to really put it together, to really get those words, to really, recall things. And it's like, even when you try, you can't. Sometimes some of us, we could just sleep on it, just get some rest, try again the next day. With folks who have Alzheimer's, this really, this is like non-existent, or it's slowly declining, like the last gentleman said. And something important that he mentioned is that we want to live for today. One thing that, through my own personal experience with both my maternal grandparents, that I understood is that every day is different. It's like this day, or you may have 2 or 3 days where, okay, I got the pattern, I got my loved ones pattern, but on that fourth day, it could be totally different, something out of the blue. And so it's best just to take one day at a time. Okay. So Alzheimer's disease is a continuum. So again, we're talking about the stages of it. So let's look at now saying that it's asymptomatic. So there are no cognitive symptoms, but possible biological changes in the brain. There's MCI due to Alzheimer's disease, early stage of cognitive ability loss. And then there is dementia dementia due to Alzheimer's disease in the stages of saying mild, moderate, and severe, where mild typically involves symptoms that interfere with daily activities. Moderate, more pronounced symptoms that interfere with many daily activities, and the symptoms severe, meaning the symptoms that interfere with most daily activities. So it's, again, like mild just like simple things, but then it starts to be more continuous. That's when you really start to notice things sometimes. And the severe symptoms, like one of the other experts talked about, where it can get to the point of not knowing how to swallow or even not speaking because the brain is not sending those signals throughout the body. So recap. So it says the three broad phases of Alzheimer's are asymptomatic MCI due to Alzheimer's disease and dementia due to Alzheimer's disease. The dementia phase is further broken down into three stages: mild, moderate, and severe. And no two individuals experience the symptoms and progression of Alzheimer's disease in the same way. So again, you may see similarities, but they may not be the exact same. And I saw this especially with my grandparents, whereas with my grandfather, his progressed a lot more rapidly, but with my grandmother, it was a little bit more slower. And as one of the words, it was kind of like pronounced, where you actually saw how deep it really can get. And it says, while symptoms worsen over time, people progress through stages at different rates as their abilities change. All right, so now let's take a look at some FDA approved treatments. So right here, what we're looking at is a list of the different types of medications that have been approved by the FDA throughout the years. And most of them came like in, say, a pill form. And I remember personally, my grandmother, she was put on the ARSAP, which was released in 1996, and the Namenda, which was released in 2003. And so while these are not cures, these slow down the progression of Alzheimer's disease, or that's what they have been approved for. And we want to make note of the latest one, and I'm messing up on my pronunciations, the Aduhelm. I'm sorry for my medical professionals out there. In 2021, this one is more of an injection type therapy that is used to slow down the progression of Alzheimer's disease rather than it being in pill form. And this is actually, it can be more helpful because one of the things that I saw with my grandmother was there were times when she couldn't swallow the pill, and or she either she refused to or she couldn't because of the signals in her brain, depending on what stage we were at the time that I'm talking about. Then we actually had to get into the pill crushing. But to avoid that, now they have this new procedure with the injections, the new therapy. Okay, so we want to talk about talking to a healthcare provider. Because everyone experiences Alzheimer's differently, these treatments work in varying degrees and are not effective in everyone. We encourage people who are interested in learning more about treatments to have a conversation with the healthcare provider. And so again, just like with any other type of medication or therapy or treatments or whatever, you have to know what works well for you or what works well for your loved ones. Because again, some people's bodies respond to different things differently. Some may take a little more time, some may be a little too strong. Whatever the case is, you want to make sure that you're having the conversation with your primary care physicians or a different care team of doctors. So now let's look a little at advancing Alzheimer's research. All right, so I think we have some more videos, yes.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
Growing evidence indicates that people can reduce their risk of cognitive decline by adopting key lifestyle habits. More and more research shows that factors like exercise, nutrition, and aggressive management of cardiovascular risk factors may impact our ability to slow cognitive decline as we age. And through current studies, we're exploring how certain lifestyle factors may even reduce the risk of developing Alzheimer's and dementia.
A lot of hope does come from the Alzheimer's Association, all the research that is being done. Even though there is not a cure today for the disease, I know in my heart there is going to be a cure one day. And I know we're getting closer for that cure. Because even if you fail in a research study, you learn from that failure in the research study. That failure always brings progression.
It's nice to see the association spearheading in many ways the emphasis on getting the money at the federal level and at the private sector to get the research done so that someday there will be an effective treatment, hopefully cure, hopefully prevention.
Okay, so again, we're trying to get into this research so that we can look at all the different ways of what's causing what, look at some underlying causes, what may also be some things that weren't determined earlier. So just to have this research so that we can, combat this, get in front of it better, being more proactive rather than reactive. All right, so let's look at some of the clinical studies that are key to the research.
Participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
You might hear the phrase negative trial, which means it didn't hit the endpoint. It didn't result in an FDA-approved treatment for the disease. But I think the only negative trial is one that doesn't provide us with valuable information. If the trial is well designed and is a good scientific experiment, we can get extremely valuable data that can help plan the next trial and make it even better than the last one. And it gets you that much closer to that FDA-approved drug, to that effective treatment, and maybe someday even prevention. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
Okay, so one thing that I just wanted to add to this and just really sum it is when we're talking about the trial matches or the clinical studies, this is a part of the research for the, to find out like what works. And we know that there are folks who have distrust in the medical system, but we're doing different types of things with Alzheimer's disease to, in a sense, regain that trust and just show that, hey, we're trying to really work on this. These are things that we're putting a lot of time into, raising money for and efforts so that we can get in front of this and possibly maybe curve this projection that has been, this projection of the number of cases, diagnoses in the future. Okay. All right, so advancing the Alzheimer's research recap. Scientists have increased their understanding of Alzheimer's significantly over the past decade. So yeah, they've been at work. We're trying to keep the work going. People living with dementia, caregivers, and healthy volunteers without dementia are needed for clinical studies in order to find methods of prevention, treatment, and ultimately a cure. Both drug and non-drug studies are taking place across the country and online. And again, if you will go to alz.org/trial match, this is a free clinical studies matching service. All right, and the Alzheimer's Association, some of the things that Alzheimer's is doing. Or where it is. So as you can see at that, Alzheimer's is on a mission to reach across the United States with chapters in all 50 countries, or access in all 50 countries. And so for more key resources, you can call by phone. This is a 24-hour hotline for anyone to call, those who may have been diagnosed or maybe in the early stage of diagnosis that still have some cognitive ability there, as well as those who need support. There's a 24-hour helpline there. There's also our website at alz.org, which there's a wealth of information of how you can get involved. And again, we have communities nationwide that you can also find through the website at alz.org. All right. And let's look at some ways to join the fight, or the way that we can engage the community more, how you can help. Through volunteering, like myself personally, I'm a volunteer. You know, I'm with the association. I've been as a community educator, as well as an upcoming support group leader. There's advocacy, the trial match. You have the different walks to end Alzheimer's. As you check on the website, you can find the different areas of what's happening in your different area. You know, over the past 2 years, we've seen a lot of virtual walks, but just, make sure that you check in with the website to find out the walks that will be in your area and the different changes, as well as the longest day Alzheimer's. Okay. Could you, Karen, if you could go back to where it says volunteer, is something that I wanted to point out with volunteer. It was something. And so again, like I said, there are different ways that you could get involved, as a care group facilitator, as a part of a care group. There are resources, there are different, there are lots of ways to be involved. You don't have to do this alone. One of the things that, I was, when, particularly with my grandmother, it's like, okay, hey, we got to do this. So I don't know how we're going to do this, but thankfully I spoke something. And, in a lot of communities where folks, it may be your norm, it may be a little cultural thing where we say, what goes on at home, we want to keep at home, but do know that there are ways that you can help. And if and again, becoming an advocate, I call myself an advocate because, I don't want anybody to have to suffer or to experience what I've had to have gone through, because of not knowledge of the sources that are available. So, we do encourage you to get involved in one way or another. And also you can donate. All these things are listed on the Alzheimer's website. All right, so now we've come to the part where if there are any questions. And I believe Dr. Ford will be facilitating that part.
Well, I just want to thank you that was an excellent presentation. Really laid out all the different stages of Alzheimer's disease. It laid out the different types of Alzheimer's disease. And it's really, almost everybody probably knows someone that's been affected, And I was just looking at the, 6 million people that have Alzheimer's, but 11 million unpaid people that are caring. So that's a huge number of people that are affected. And, one of the things, as I'm a internal medicine physician, and I see patients every day, every week, who come in or having difficulty with memory. I think it's so important to try to get people to come in and get screened. And some patients with Alzheimer's, they really, they know they have a problem, but they don't want to come and express it. And that's where family members come in, right? The people who care for them, to come in and just, let their physician know that, hey, they've been having these problems. and sometimes your story that we get from the patient, because a lot of patients are good at hiding, right? They're good at hiding their symptoms until they can't hide it anymore. But we want to catch people early. So I think it's important for family to just be aware of your elder people over 65 or even younger, as we know you have early onset Alzheimer's disease, patients under 65 that have it, and just be aware. And I think that's one of the comments. Yes, sir.
Yeah, something I want to tag onto that. If possible, also like go to those doctor's visits and sit in the office with the doctor, because something that I experienced with my grandmother was she would go to the doctor. I would just wait in the waiting room, and then she would come out, and then we go out and say, "Well, how did everything?" She said, "Oh, everything all right, nothing's wrong." And that's what I would just take, because that's my grandma, or like mama, and I'm just going to trust that whatever she said was what the doctor said. It wasn't until that day when the doctor said, "Hey, can you come back here with me?" And then when he started saying stuff, and I'm looking like, "Grandma, why didn't you tell me this?" So be involved, engaged as much as to the max and beyond.
That's correct. It's so important to even. I have some patients that even send a note their relative ahead of the appointment. Hey, I have these concerns, and then want to know whether they can come in. And a lot of times I'll have them come into the room, and then all of a sudden things start coming up even more. But one of the things I think that's important, even for physicians, to making sure that, especially patients that have Medicare who are over 65, we screen them every year when they come in for their Medicare wellness exam for dementia. And, there's different tests. One of the ones that I use is called the mini mental status exam. And that kind of brings up sometimes patients will be able to hide things, but when you start getting into the test and all of a sudden they can't, they're a professor somewhere, and then they can't do simple subtraction, or they can't remember what season it is, or they can't, all of these things that we ask in the mini mental status exam. So, definitely encourage when you come in. Well, that should be part of what the physicians are doing when they come in, definitely at 65 and over. But even we need to screen probably even younger if you see any problems.
That is so important for early detection. As you see with some of our research, the earlier you identify the disease and the possibility for at least adapting lifestyle or participating in clinical trials is there. So definitely, or the drug therapies that are currently available can address some of the symptomology.
Exactly. And another thing that, and we know, as we mentioned, Alzheimer's is a part of dementia. There are multiple type of dementias. Yes. And sometimes patients will have mixed dementias where they may have vascular dementia and Alzheimer's dementia. And so that's why I think you mentioned controlling the risk factors, cardiovascular risk factors is so important. And when we talk about cardiovascular risk factors, controlling the blood pressure, because hypertension leads to many strokes and major strokes, but also many strokes, which can affect your memory. Cholesterol, controlling your cholesterol, which clogs up arteries. All of these things are important. And that's why coming in and making sure you're getting screened, getting your blood pressure checked every year, getting your cholesterol checked, all those things are so important.
Yes, they are. There is some studies that have gone on recently that not only controlling some of your healthcare risk factors, but also exercise, diet, staying mentally engaged as well as cognitively engaged. All of these types of lifestyle changes can help to reduce the progression for folks who may be in the mild cognitive impairment stages or asymptomatic. There is now some good research that shows those healthy lifestyles can slow the progress down.
Correct. And so, that's definitely important. And I think, you can probably count on our fraternity Gamma Pi chapter to try to help with the walks for Alzheimer's. I think I'm going to try to make sure I spearhead that so that we can help support and gather funds, because I think it's just so important for us to do that.
Thank you very much. We appreciate your support.
Okay. Well, I think, as I mentioned, thank you for the Alzheimer's Association, Ms. Karen Fagan, and Mr. Robert Densler for presenting this important topic. And I think we have a third series coming up in June, and looking forward to you guys coming back with us. Okay.
Great. Thank you, Dr. Ford. Thank you, everyone. Have a good Memorial Day weekend. Bye-bye.
Thank you.
Ditto.
All right. Bye-bye.